Hello, my name is William Tapper, and I'd like to thank the Prevent Breast Cancer charity for funding our project, which is titled Risk Prediction of Young-onset Breast Cancer and Involvement of Tumour-Infiltrating Lymphocytes. I'll now give you a summary of the aims of our project. Clinicians need accurate predictions of disease risk to guide decisions about when to offer screening for breast cancer, and after a diagnosis, which are the best treatments. These decisions are currently made using a combination of family history, genetic and lifestyle factors, and also tumour characteristics. Researchers have identified just over 300 genetic variants that increase the risk of developing breast cancer. A recent study suggested that a polygenic risk score, or PRS, which estimates risk based on a combination of these variants, could be used to identify women with a high risk, who would then be eligible for surveillance screening at a younger age. However, the existing PRS was developed using mostly postmenopausal patients, and when we tested it, we found that it was less accurate in women who were aged 40 or under at diagnosis. Our pilot analysis also showed that some of the variants used to make the PRS were not associated with young-onset breast cancer, and that other significant variants weren't included. We therefore aim to develop and validate a new PRS, which is optimised for young-onset breast cancer, using two cohorts of early-onset patients called POSH and BCAC. The funding from Prevent Breast Cancer will be used to complete the genetic characterisation of the POSH cohort. We will then use this data to identify novel genetic markers associated with young-onset breast cancer and make a new PRS that will be assessed for clinical utility in the BCAC cohort. We believe that the new PRS will help to improve the accuracy of risk estimates and better select women for surveillance screening that will ultimately improve patient outcomes. Our second aim is to use the genetic data to identify variants associated with tumour-infiltrating lymphocytes, or TILs, which are white blood cells that have invaded the tumour. Understanding this process is important because TILs indicate that the immune system is attacking the tumour, and because patients with high levels of TILs are more likely to respond to treatment. Few studies have looked at the effect of a person's inherited genetic makeup on the level of TILs, and this is something that we will investigate in the POSH cohort, where we have TIL data for over 300 patients. We hope that a better understanding of the relationship between genes and TILs will help to select patients that would benefit from chemotherapy before surgery, or from entering clinical trials of new immunotherapy drugs. Thank you for listening, and I look forward to sharing our results with you.